And with that, Dr. Miller-Meeks.
Thank you very much, Mr. Chair, and thank you for this important hearing. The questions I ask are coming both from the fact that I'm a 24-year Army veteran, as is my husband, and I'm also a physician and former director of the Iowa Department of Public Health. And we looked into toxic exposure, especially where we have the Iowa Army ammunition facility, which is within my district. And I voted for the PACT Act, the improved PACT Act, when it came back from the Senate, voted for it, but still had some reservations about this bill. Not our obligation to take care of veterans who may be injured at the time or in the future from their service, especially in combat, but in other parts of the bill, which I'll address. Mr. Rakowski, the Toxic Exposure Fund statute is somewhat ambiguous, and the VA has written policies to govern how the money can be spent. What is not allowed?
Well, maybe I can give you an example. Best example I can give of that is we have a PACT program management office. We have a director of that program office. When the PACT Act was passed and the Toxic Exposure Fund was created, we thought, well, certainly the director of the PACT Act project management office, his salary would be funded. But when we worked through that with our general counsel, they said absolutely not. The Toxic Exposure Fund is only for costs related to toxic exposures. That individual does not spend all of his time or even most of his time specifically on toxic exposure, so you really can't charge, certainly not all of his salary, probably not most, maybe not even any of his salary. That's an example of the type of thing we have to go through to make sure that it's related to toxic exposure only, not just costs with the PACT Act.
And can you get us the other things that are not allowed or covered? You can submit that in writing.
Okay.
Most people thought the Toxic Exposure Fund, which was part of the PACT Act, was intended to pay for implementing the PACT Act. But the VA has also been using it to pay for toxic exposure-related programs that already existed. Can you identify those programs?
We only use it in most cases to the extent, well, really all cases to the extent that it exceeds, for example, healthcare, the 21 baseline, or that it's related to toxic exposure itself. And so we're not shifting baseline costs to TAP. I know people say that, but that's just simply not the case.
I'm sorry, you just said that you're using it for healthcare costs that exceed the 21, but amounts that were already allocated and appropriated for toxic exposure and programs that existed prior to the PACT Act or the Toxic Exposure Fund. Why would that be permissible?
Well, Laura Duke wanted to make a comment on this.
If I may, the way in which we execute healthcare in our system doesn't lend itself to the strict fencing that we've done, because we didn't want a situation where we hired a provider and that provider was only approved to deliver medical care to PACT eligible veterans. We wanted to ensure that we were maximizing the use of our provider's time and that we were helping as many veterans as possible receive the care timely. So what we are looking at is we are taking the PACT and the TEF and baseline funding as the total that's available for us to run our system. And then after the care is administered, we then are accounting for the total cost of the care, the visits where toxic exposed veterans are receiving the care, and those are the costs that we're...
I'm going to reclaim my time, but I'm going to say that's it's a nebulous, ambiguous cost shifting as a physician who takes care of patients. My next question is the concerns I had about the PACT Act and presumption of toxic exposure leading to a disease either now or in the future. And part of the PACT Act has research. Why do we want to continue research and development and to find out if there really is, and if an exposure is in fact related to a disease status, if we're going to presume that every disease is related to some toxic exposure, whether it is or not? And then number two, the follow-up to that is, in the PACT Act, we also continue all of the health care, all of the benefits, even if it's proven through scientific measures that there is not a causality. So is this a portion of the PACT Act and funding that we don't need, because in the PACT Act, the presumption is that any toxic exposure has created disease now or in the future. And you're talking about future presumptive exposure.
I think our research program first improves the quality of the healthcare that we deliver by learning better ways to treat the conditions in question. And to the extent that the future disability qualifications is making sure that not only are we providing the health care, but that veterans whose quality of life has been compromised as a result of their exposures
So
are adequately
the
compensated.
treatment modalities is different than research into presumption, which a lot of that, I think, if we have a proper implementation of the electronic health record and coordination with the DOD would help that. I yield back my time.